And now we're going to transition to our fireside chat that's focused on nutrition-sensitive systems. And I just want to say again about how this got started. Our staff at the World Food Prize Foundation said, we really want to have a discussion taking in the local, regional, national, even international level and looking at nutrition across this spectrum. And that was kind of the broad overarching blueprint. And then we brought in Angie Tagtoe and Christine Reddick, two experts focused on very different things who could speak to this wide range of topics that we want to touch on in this nutrition-sensitive roundtable panel. And of course, Angie is this titan giant who, under the Obama administration, was the executive director of the nutrition policy and promotion. And then Christine is working at Iowa State University on really local specific nutrition issues. And so we brought them together and we started talking together about this term, nutrition sensitive. And both Angie and Christine said to me, we know this term, we talk about it, but it's not really socialized all that well in our context in this state and even across the country. We understand it more in kind of this international sense of the word. And so they said, why don't we take that term and really socialize it with our audience here in the United States and put a definition to it. I think we have Angie and Christine now.
Yes. Good morning, Kyle.
Good morning. It's so wonderful to see you both. And so just going further with that introduction, I'll be kind of asking and fomenting a discussion with both Angie and Christine in a little bit, but we wanted to give you that definition of nutrition-sensitive systems. So, like I said before, the kind of the nutrition-sensitive interventions have really lived in this international realm. This international realm focused on nutrient deficiency, and we think our situation is similar here in Iowa, but a tad different. And so, along with that kind of food insecurity piece, we're also really focused on the piece of nutrition that reduces the number of non-communicable food-related diseases, along with nutrition insecurity. So, what is a nutrition-sensitive intervention or policy? So these interventions or policies are those whose primary objective is not specifically nutrition, but have the potential to improve the food and nutrition security of beneficiaries. This approach targets the root causes of food and nutrition insecurity, but has little to do with the actual food system or emergency food support that go to hungry people. The nutrition-sensitive definition broadens the lens and the universe of parties that should act to ensure Iowans have access to healthy food. Broadening the universe of stakeholders that should craft nutrition-sensitive approaches provides much, much greater avenues for individuals to act. And so let me just give you individuals, businesses, governments to act. So let me just give you some ideas. And we actually, the last roundtable touched on these issues, right? Direct payments to parents, right? Making childcare less affordable. Giving women much better schooling opportunities. So those are much broader. But on a local level, even smaller things like giving students longer times to eat lunch, for example, or embedding nutrition sensitive security issues within curriculums, or for employers to have more flexibility for time off, especially for caregivers, and for businesses and other employers to look at their wage structure and really think about what it takes to actually live in our society and just make their workers' lives just a bit better by analyzing their wage structure and then adjusting it. So, I'm going to bring in Christine and Angie now. And just, if Angie, if you could just kind of ruminate or talk a little bit about what you think about this definition and your experiences.
Yeah, actually, I'll have Christine tee us up.
All right, go ahead, Christine.
Thanks.
Thanks, Angie, and thanks, Kyle, for having us here today. So similar to what we heard from our previous panel, I really liked the language they used that nutrition or food security is likely a flag for something else happening in someone else's life or in someone's life. The root causes and predictors of food or nutrition security are not likely going to be addressed solely by programs, interventions, initiatives that are focused specifically on food and nutrition. Instead, it's a symptom of deeper challenges. So as you mentioned, Kyle, this could be someone earning wages below the self-sufficiency threshold. Lack of access to childcare is a huge problem in the state of Iowa. We all got a little taste of that last year across, all groups within society, but that's a challenge that folks who have low income deal with, chronically. And it just results in really difficult decisions every day and month as people are trying to manage their households. So I think these deeper contributors to poverty are what we really need to look at in order to expect permanent changes to nutrition security in the United States. So generally, these further upstream discussions, I think, are where the focus needs to be when we think about long-term change.
Great points, Christine. And what we're really describing is a root cause analysis, if you will, and it allows us to really peel back those layers of the onion to expose those factors that contribute not only to poor dietary patterns and chronic diseases, but also to hunger and food insecurity. We often refer to these issues as wicked problems. So when we have a wicked problem, such as food insecurity and hunger, and I might add in a state in which the leading economic driver is agriculture, we need to take a systems thinking approach to fully understand all of the factors that Christine just talked about, as well as in the previous panel, that really contribute to the wicked problem. So whether it's food insecurity or when we talk about that forward thinking construct of nutrition sensitive food systems, it really requires us to not only examine the human health dimension of it, but I would argue it also requires us to examine that social health, that economic health, and the environmental health element of that wicked problem. And because these issues are multidimensional, it requires us to forge new relationships. And we heard that very clearly in the earlier panel today. But it also requires us to think about creating a group of very dynamic strategies in order to address those root causes. And we've learned that singular technical solutions is not going to solve hunger, malnutrition, and food insecurity, and that these wicked problems really require much more of a bundled approach of innovative strategies to really get at those root causes.
Thank you, Angie. And just turning to my first question in this fireside chat, I guess this is really the second question, but who's counting, right? Could you tell me a little bit more about instances where you've seen kind of successful interventions that have effectively dealt with the root causes of food insecurity, but also nutrition insecurity?
Sure. I think, thinking about nutrition insecurity, our panel that we just heard from is a wonderful example of all of the things that are happening that, though they may not necessarily be addressing the root causes, which are these complex economic systems, but are providing really valuable services to help families manage within their reality. We heard from our amazing food bank and pantry network partners across the state who have, been through dreadful circumstances over the past year and a half and made a difference for so many Iowans. I personally am always really proud to talk about the food rescue initiatives that happen across the state of Iowa. There are a lot of them, but I think about Table to Table in Johnson County, Eat Greater Des Moines here in central Iowa, that really have implemented community-based systems that not only get food to people who need it, but reduce a huge amount of waste. Food waste is, as Angie said, a wicked problem. And it makes it all the more difficult to talk about nutrition insecurity when we know how much food is wasted. So I think of food rescues as another example of just a really good service to help address this problem. We also have educational and skill building opportunities that Iowans can pursue to help them learn to stretch their food dollars and help them set and reach goals that matter to them. So there are programs like this through ISU Extension and Outreach, also the Iowa Department of Public Health, that are funded by an arm of SNAP that's called SNAP Ed, that is in every state, and that allows us to implement programs for Iowans of all ages that are meant to help make healthy choices easier. We heard on the last panel about all of the great things that have happened with USDA nutrition programs during the pandemic with SNAP and WIC and SNAP EBT and the school meals programs. We also have a wonderful Double Up Food Bucks program in Iowa. And I thought that Christina and Monica and Zuli on the last panel shared really neat examples of uniquely tailored community-based interventions addressing specifically tailored needs. And so I think where we can create and promote flexibility within what might be a really large initiative will be more successful if communities are able to customize interventions to local needs. And if our systems are able to provide funding that maybe is accustomed to operating in a monolithic way and adjusting it to operate in a way that can be tailored to what even a neighborhood might need, thinking about the community fridge example. I think that kind of tailoring allows us to really meet people where they are.
Couldn't agree more, Christine. And, this morning we heard of the many great initiatives in Iowa. And we also know that there are some really great examples and organizations across the country that do some part of addressing food insecurity and hunger really, really well. We have amazing community-based and government organizations here in the state that not only support the emergency food system and the needs of individuals and households, but more importantly, of communities. And these services are extremely essential. But what's really exciting, and we heard a little bit about this morning, we're seeing that these organizations recognize that, yes, providing direct access to food and nutrition services is essential, but it's just the tip of the iceberg. We can be more effective, and we can also engage the community on these issues, and we can work with other providers and partners in the community to ensure that families have access to healthful food. And they're also realizing that the value and the power of collaborations and to collaborate with other organizations to better address the root causes of the complex issues. So it requires us to think about our settings where we live, learn, work, and play, and our environments, and how we can also ensure that our environments support healthy eating as well. And these organizations are starting to acknowledge and influence the environments. And they recognize that the power of even looking at their own organizational policies or engaging in public policy can be very powerful key change drivers. So in summary, providing the direct services, and especially the ones that Christine just highlighted, is great. They're essential. But there are many more tools in our toolbox that we can use to inform policy, system, and environment strategies too that address those root causes.
Thank you, Angie. About a week and a half ago, I talked with A.G. Kawamura, former Secretary of Agriculture in California. And if you know anything about A.G., he's got ideas coming out of everywhere. And in the middle of our conversation, A.G., who's this phenomenal farmer, he farms mostly strawberries and green beans now. But in the middle of our conversation, he told me he believes that it's possible that California will end hunger by 2030. He said before 2030. And he was espousing this focus on root causes and transforming social systems to do it. If anyone can do it, he's a farmer in Orange County. I believe in AG, but what about Angie and you, Christine? Do you think it might be possible for us to provide nutrition and food security for all Iowans by 2030? It's a big goal. I throw it back to you guys.
Indeed, Kyle, that is a very bold goal. And, I applaud his vision. And I'm confident that he understands the complexity and the partnerships that are needed to achieve that goal. So Kyle, for Iowa, I recommend one way of approaching this is to shift our focus from a deficit state. And by that I mean focusing on hunger and food insecurity in Iowa. And I propose that we take on more of an asset state approach to food and nutrition security. And so this slight shift in framing is critical as it puts really all Iowans in the center of the solutions, right? It's not segmenting populations in Iowa. All Iowans have a stake in this conversation. And so it allows us to really identify the best practices across all systems. And I'm not just focusing on agriculture and the food supply chain. They're a very critical system within this conversation, but also the healthcare system. Looking at business and industry, and our food retailers are very important. Looking at education systems, and looking at them from the frame of how can they contribute to advancing resiliency, security, and the health of our food system. So here's an example. We're seeing this type of shift happening at the federal level, in which USDA is now using the term nutrition security in addition to or instead of food insecurity. And it's offering a pivot or an expansion of their research, of their discussions, and even the initiatives within USDA. And I encourage you to check out the National Institute for Food and Agriculture new series on nutrition security. They're excellent. But, I'm an eternal optimist, and I do believe Iowa can make strides in creating a nutrition-sensitive food system by 2030. Mind you, that's less than 9 years away, right? But the key ingredients in doing that include the following. It includes having a really strong and vivid vision. It includes having leadership. It includes having strong partnerships across all of these systems. Resources, of course, are a necessary ingredient in order to address these wicked problems. Need a little bit of perseverance. And I think the panel prior really demonstrated the perseverance, especially over the last 18 months, in providing services to families in Iowa. And the last ingredient, I'll be frank, is political will. If we can do that, we will witness dramatic changes, not only in hunger and diet-related chronic diseases in Iowa, but we will see positive consequences, again, from the social health, the economic health, and the environmental health standpoint, too.
Thank you, Angie. So I'm going to get a little bit hypothetical here, but if either of you could enact any policy or program or set of policies and programs that dealt with the root causes of food and nutrition security, what would it be? What would that look like?
So Christine already set the stage for this conversation, Kyle. So I'm going to take the first pass at it, and then she's going to follow up with some poignant remarks as well. You know, and we know that economics is a significant factor to household and community food and nutrition security. So if a community is struggling and does not have a vibrant economy, the people who live in that community are also likely struggling. We know that there's an ever widening wage gap, and that needs to be addressed. Families that are working 2 to 3 jobs and still not making ends meet is a result of unsustainable wages that aren't keeping pace with the cost of living. And so part of that solution, again, is having that suite of synergistic economic policies that make healthful foods affordable to all. It adjusts that minimum wage so a 40-hour work week can support a household. The policies need to support innovative economic development, especially in rural areas, and we're seeing that, of course, here in Iowa, and making sure that all communities have the utilities and services that they need. For example, technology, making sure that communities have access to broadband, looking at utilities such as water supplies, even access to a grocery store. So those are just some examples of the dimensions of that bundle of economic policies that we could look at. And so the economic policies or the economic system are really needed to strengthen both household and community resources. And this is needed to then address the aspect of nutrition security. But another factor, Kyle, in the root cause analysis in this equation is the education system. And when I refer to the education system, I'm referring to everything from early care all the way up to post-secondary education. And the questions that I have is, what can we do within the education system to specifically address the issue of nutrition security? So some thoughts include, and these are just examples, integrating food, nutrition, and health and that experiential learning into all curriculum. That enables strengthening that student's knowledge and skill level, and I think leads to self-sufficiency as an adult. Another example would be to create school environments that support healthy eating. It kind of makes healthy eating really normative and that default opportunity. Another example is to look at state and federal policies that ensure that all students are well nourished so that they're ready to learn. And we know what the data says about that and the relationship to increased graduation rates. You know, and last, it also includes strategies that prevent students in colleges and universities from going hungry. And I would argue that it includes greater investments in food and nutrition research at institutions of higher education. So you're seeing a spectrum of examples there. So my point is that a comprehensive suite of strategies within the economic and education systems can make a positive impact on the food and nutrition security of Iowans.
Thanks, Angie. I can kind of follow up with some additional points from the perspective of, you know, a little more on the ground in Iowa. Angie has an amazing macro perspective on these types of questions. And when I thought about this question from the perspective of, say, the families that we serve in our programs and get to know a little bit, there are a couple things that jump out to me here in terms of what would make a difference. One of those things we actually saw enacted a couple of weeks ago, which is the dramatic and permanent change to the SNAP program, the adjustment to the Thrifty Food Plan, which is what informs the SNAP benefit allowance to Americans. That change modernizes the SNAP program in a really meaningful way. It takes into account the fact that working families have often all parents in the household working. There's not someone home tending the household all day, able to operate on a very slim budget, baking their own bread, all food from scratch, not needing convenience items, those types of things. So that modernization, I think, is a huge step forward. Another thing that comes to mind for me, which is something that all of us got a taste of in the last 18 months, is the childcare crisis. Insufficient access to adequate professional childcare. Currently, when we think about the benefit structure that is in place to support families with limited resources, childcare assistance is one of the first benefit cliffs that you encounter as your wages stabilize and increase. So this can contribute to a really challenging cycle for people. And so I would like to see, increased access to affordable childcare, and childcare support being one of the last things that you lose as your benefits stabilize or as your wages stabilize and increase, rather than among the first. I think that we've all lived through now a lesson in how critically important childcare is to our economy. And that's something that, we see with the families we serve every day. And I think the wider community had a taste of it in the last 18 months. So when we think about folks' ability to sustain gainful employment, I think childcare is a huge piece of that.
Great. Well, we're going to move from that kind of more global level down, really focusing now into kind of nutrition-specific areas, really getting into, Christine, your wheelhouse here. And so, Angie talked a little bit about this kind of assets deficits definition approach, but I'm quite interested in kind of highlighting successes. And maybe also learning from a bit of the shortcomings in the development and implementation of specific nutrition programs. I'd just like to ask you to discuss kind of different approaches that have been taken in regards to nutrition programs in general. So go ahead.
Sure, thanks, Kyle. So nutrition education and skill building opportunities around food budgeting and food budget management have been around for a really long time, and they have evolved a lot in the last, say, 50 years or so. And many of the trends that we see in nutrition education mirror those that we see in broader educational settings, whether they be formal education or informal. In the past, we tended to view education as kind of an empty vessel or blank slate model, where the teacher is imparting knowledge to fill some kind of void that the student has. And in nutrition education, that might look like one standard set of dietary advice that is considered universal for all, where certain food ways are praised and others are vilified. And this model creates kind of a hierarchical relationship between the student and the educator, and discounts, really unfortunately, the past experience and traditions and values of both the student and the teacher, right? It's a one-size-fits-all approach that isn't a fit for a lot of people. And that then is not helped by the fact that we have this societal tendency to apply moral judgments to food and food behaviors. So if you think of an example in your own life where maybe someone says, "Oh, you're so good, you ordered the salad," or "I'm being so bad today and I'm going to have chocolate cake." So we're bombarded with messages like this on a really constant basis. And it might come from individuals in our lives, but it also comes from the media. And it can result in us feeling unwelcome in spaces that are focused on nutrition and healthy choices. And so from a nutrition education program perspective, that is very unproductive. We can't have that happening because it's going to keep people from attending our programs.
Great. So was there something that kind of necessitated this change? I mean, in approach? Was it kind of, I'd hate to say it, but poor program outcomes, feedback from participants? I mean, just kind of general academic bubble up. That's a technical term, by the way, bubble up. But go ahead.
So I would say there is a long history of evaluation in nutrition education programs and evidence of success. So I don't think it's necessarily a problem of, oh, these programs are so ineffective. There's a lot of success in this work in the past. Though, just like any other industry, we must stay relevant to our clients and remember that they have the choice to engage with us or not. And adults are understandably and appropriately very protective of their time and attention. So before we can measure program outcomes or reduction in surveillance data like chronic disease rates, we need nutrition education programs that people want to attend. They're valuable, relevant, relatable, engaging, and engaging to our clients' whole lives, not just what's on their plate at any given meal.
Great, that's really amazing. You know, could you talk to us a little bit about kind of an assets-based program, if there's one out there that's really focused on assets?
Sure. An asset-based program would be one that takes into account all of the strengths that a person has, all of their traditions, culture, values. Like our panel spoke about before, food is so much more than just the nourishment for our bodies. And ultimately, anyone who's considering coming into a nutrition education program is bringing a lifetime of experience with them and traditions and food ways that matter to them. And so I really see a trend in nutrition education right now of trying to honor that and make that part of the discussion. This is not unique to programs we're working on in Iowa. We see this very broadly as an effort among nutrition educators to make sure that we are acknowledging that fact, that food means so much more than just sustenance for us. And with that comes richer discussion and hopefully a more welcoming environment for our clients.
Well, thank you, Christine. It sounds just like a great pivot and really kind of focusing in that area where we can uplift people and really deal with the root causes of hunger. So I'm going to move then and talk to Angie a bit about, we've been hearing from Christine about these local level programs focused on assets and moving away from these deficits-based programs. You've been engaged in policymaking at the national level as a high officer in the Obama administration. Please talk to us just about your views and approach to federal policymaking and how that kind of filters down to us here in Iowa.
Yeah, and the challenge will be to do that briefly. Well, first of all, I think we need to look at policy in two different dimensions. First of all, we have policy at an organizational level. Doesn't require an elected official to drive policy at an organizational level. And so at an organizational level, what can we do to put best practices in place to support healthy eating within an organization? The second level I often refer to as the big P, that's the public policy, the legislative piece of the conversation. Both of these in tandem are powerful change drivers. Unfortunately, many policies at both the organizational level and the public policy level, they're oftentimes enacted based on whether they're real or perceived problems or challenges, and that's what brings about that deficit-based approach. And not so much developed based on that forward thinking or asset-based approach, and more importantly, to help build resiliency within a system. So I also think we need to put on our critical thinking caps and try to understand what the primary aims of key pieces of legislation are, whether that's within agriculture, food, and nutrition. And, asking the questions, are the motivations purely economic? Are the motivations to prevent future disasters from occurring or better response to disasters? Is the intent to perhaps establish an even playing field for all scales of producers, processors, and food retailers. Is the intent of the policy to really prevent disease and promote health? Or is the intent of the policy to generate more and robust research to better inform future policymaking? And probably many, many more questions like that. But knowing the motivations behind the policies are really key. And so when we entertain a new motivation, especially one that is asset-based and forward-thinking, such as nutrition-sensitive food systems, as part of that public policy process, we begin to shift the focus on the intended beneficiaries, for example, and I mentioned that earlier. We begin to see new strategies and innovations emerge. And we may even see new partnerships and collaborations as well. So, for example, if nutrition security or nutrition-sensitive food systems become a pillar of, let's say, the upcoming Farm Bill, with the aim of weaving that theme across all of the titles of the Farm Bill, I really think we're going to have we would have a very different piece of legislation than what we have now. So if nutrition security and nutrition-sensitive food systems were aims of upcoming revisions to the Child Nutrition Reauthorization Act or the Older Americans Act or even the Affordable Care Act, as well as many others, we would begin to witness a collective approach to more resilient and nutrition-sensitive food systems, which would greatly impact not only dietary patterns, but the overall health of Americans and the economic impact when it comes to healthcare costs. So, mind you, my perspective is as of a dietitian who works in public health and food systems. So the state of a population, whether it's at the state of Iowa or nationally, has been central to my work throughout my career. And we know that average diet quality in the US is poor, as indicated using the Healthy Eating Index. This directly contributes to the high rates of overweight and obesity and other diet-related chronic diseases, which directly contribute to the $3.2 trillion in healthcare spending that we see every year. So from my perspective, my critical inquiry includes questions such as, well, why aren't dietitians not in every local public health agency in the country? Why are we not seeing dietitians once or twice a year for a nutrition checkup, very similar to seeing your primary care provider or even the dentist? So why are insurance companies not reimbursing the services of a dietitian? Why do we not have registered dietitians based in every school district or within every long-term care facility in Iowa? And I could go on, but my point being is that finding answers to these and other questions help us build better policies. And so a tool that you all can use in your partnership and your network meetings is to put that complex problem on the table and ask why 5 times. That's the beginning of a root cause analysis. And then you start this critical inquiry process. But what I believe needs to happen at the federal level today, right now, is that more resources and funding and a coordinated approach to food and nutrition research, to nutrition guidance systems, to nutrition education, and even nutrition outreach and extension has to happen. This is the first step at the federal level in advancing nutrition security, building that resilience, and focusing on nutrition-sensitive food systems. And so, as I mentioned earlier, the key ingredients to move the needle, not only here in Iowa, but at the federal level as well, is having that clear vision, having leadership that is committed and dedicated to that vision, creating strong partnerships, having resources at the table. Of course, these types of changes to complex problems don't happen overnight, so you need that elements of perseverance. It's a marathon, it's not a sprint. And last, that key ingredient of political will.
Great. Thank you, Angie. That is, just so forward-thinking. To ask those why questions, just phenomenal, and really kind of embedding those things not just in our food systems, not just in our nutrition systems, but throughout. So I think for our kind of last question that we have, at least in terms of the one that I've laid out, is how do we reimagine, reconfigure for the future? I think, Angie, I think you laid that out. So maybe Christine, you could talk to this a bit more.
Sure, thanks, Kyle. So I think we've described how the lens really must widen to address nutrition concerns by looking upstream at our social determinants of health if we want to see lasting changes to nutrition security in the United States. And in the meantime, I think being prepared to do our best as nutrition professionals and as decision makers, and even as community members, to design programs that are responsive to communities, which we saw great examples of in our previous panel, that acknowledge and celebrate the experience and diversity of our clients, because that's going to help them feel welcome and engaged in what's being offered. But also just creating as many learning opportunities as we can for each other to create those partnerships, connect across different systems. As Angie, it's going to take a huge constellation of partnership to make this type of goal, come to fruition. And so that requires the kind of connection that hopefully the summit is contributing to that. So I think all of those are pieces that go into this. And I think we've seen some great examples of that today as well. And in my experience, as I work in a USDA funded program called SNAP-Ed and another one called FNEP, I do see these things happening. They're happening on a community scale, a state scale, and the pieces are starting to come together. I've seen such dramatic changes in how we deliver education for families, but also how we design programs to work in communities. There's still a long way to go, but I'm really proud of what I've seen happen in the folks working in this space. So that gives me a lot of encouragement and hope for what's next.
Beautiful, Christine. Thank you. I guess, Kyle, my takeaways from today, again, to engage in that critical inquiry and to ask questions, to ask the really tough questions in order to get to the root causes. We need to nurture new collaborations and partnerships. We need to work with others so that we can make a collective impact on these wicked problems. Remaining informed of the public policies, not only at the local, state, but also at the federal level, will just help us make more informed decisions as well. And I think to be bold and courageous. And ironically, I came across a quote from Simon Sinek this week that I really think speaks to the theme of what Christine and I were addressing today. And he said, when we focus on our strengths and lean into the strengths of others, we can make the impossible possible. So if anyone can leverage the assets and the best practices and all of the great things that are happening in this state in order to establish resilient and nutrition sensitive food systems, it's Iowa.
Thank you, Angie. Thank you, Christine. You are two experts on the front lines of these programs, of these policies. We thank you so much, and we thank you for being here at the 15th Annual Hunger Summit.
Hello, I'm Mike Negg, Iowa Secretary of Agriculture, and it's my pleasure to welcome you to the Iowa Hunger Summit. And I look forward to this event each year, along with the broader World Food Prize dialogue. Iowa has always been a leader in agricultural production. We're the leading producer of corn and pork, eggs, and renewable fuels. 1 in 5 jobs in Iowa is connected to agriculture. As long as we've been farming in Iowa, we've been innovating to grow more with less. Iowa's farm families adopt practices and technologies that increase the quantity and the quality of the crops they produce, while protecting our soil and water resources. And our livestock farmers are finding new ways to protect animal health and raise livestock more sustainably. I'm always reminded during World Food Prize events about Norman Borlaug's childhood home outside of Cresco. If you haven't visited, you really should. He was a farm kid. He grew up in rural Iowa, and he went on to save 1 billion lives thanks to his work. And he has inspired generations of hunger fighters to join the cause. Borlaug set an incredibly important example for all of us. He proved that it doesn't matter who you are or where you were raised, you can make a difference in the world through agricultural innovations. Borlaug's legacy is carried on by the next generation of agricultural leaders. As I travel the state, I'm fortunate enough to speak with many of these leaders firsthand. These Iowans recognize needs, and they find creative solutions to fill them. Putting innovative ideas into action means we are making advancements every day to deliver more nutritious food, cleaner burning fuels, healthier animals, and cleaner water, and a better standard for living for families all around the world. With the 2021 harvest right around the corner here in Iowa, the Iowa Hunger Summit and the upcoming World Food Prize Dialogue presents opportunities to celebrate our great agricultural heritage, but there are also opportunities for a critically important conversation about how we can work together to ensure that everyone has a healthy, safe, affordable food supply to put on their tables here in Iowa and around the globe. Thank you for being a part of this important discussion today and for your commitment to feeding everyone, especially those in need.